For those of you who want to see this talk as clearly as possible, please select speaker view um, or pin my video. And with that, I will take it away. Alrighty. So today I'm going to talk about the emergence of SARS-CoV-2 in Europe and North America. This is a work that was recently published in Science through a multi-institution collaboration ranging from the University of Arizona to USC, to Edinburgh, and also UC San Diego. And in particular, I'd like to acknowledge the lead of this project, Mike Warby, who is my doctoral advisor. I haven't worked with Mike since I graduated in 2009, but a pandemic brings people back together, and here we are. I also want to acknowledge this guy right here. This is Jonathan Pekar. He's a graduate student at UC San Diego in the Bioinformatics and Systems Biology program, and he did a lot of the simulation work that was integral to the success of this project, and he deserves a big shout out for that. Alrighty, so as I last checked, there are about 7 million cases of SARS-CoV-2 in the United States. And the question that we want to know is, how did we get here? How did it all begin? And to do that, we need to go back. We need to go way back to before most of us can remember January 15th, 2020, which seems like years ago. And what happened on January 15th? Well, we knew that some virus was circulating in China. We knew that it had spread to a couple other countries. We knew that it was a coronavirus related to SARS. It didn't even have a name yet. We were still calling it the novel coronavirus. But on that day, a gentleman from Wuhan, China, boarded a plane and flew to Seattle, Washington. And when he arrived there, he may have been feeling sick, but he started noticing CDC messaging, and he was screened. But he went to his home in Snohomish, Washington, which is just north of King County, which is where Seattle can be found. So we're talking about a county very close to a major metropolitan area. 4 days later, he notices that he's feeling symptomatic. He's well aware that he just traveled from Wuhan. And back then, the CDC guidance was clear and concise. If you've been to China and you're experiencing flu-like symptoms and you have a cough, or please seek medical attention, go to a hospital, get tested for this novel virus, which is exactly what he did. So he was aware of the public health guidance and he followed it. And as a result, the first introduced case into the United States of COVID-19 was discovered, and its genome and the genome of this virus was sequenced, which we will call WA1 for the first sequence from Washington. And just keep in mind, this is an important acronym that I'll need to refer back to again and again throughout this talk. All right, so over the next 6 weeks, we have 59 confirmed cases in the United States. All of them are linked to either travel or contact with an additional confirmed case, and none of them are found in Washington state. So what that means for the state of Washington, that had its first had the first case of COVID, where appropriate contact tracing and testing measures were put into place, it seems like they were able to stage the epidemic in Washington and prevent any further transmission. Now, just as a slight interlude here, we get to February 22nd, where something, depending on your viewpoint, important or completely inconsequential happens. And it comes out of Washington, D.C., which is this proclamation of suspension of entry as immigrants or non-immigrant persons who pose a risk of transmitting the 2009 novel coronavirus. Again, before we even had a name for it. Now, what this executive order did is it prevented people who weren't residents or married to residents or immediate family of residents of the United States from returning to the United States from China. It did not prevent nearly 40,000 U.S. citizens, residents, and their relatives from arriving at 5 airports around the country to queue in long lines, be told that they'll be followed after arrival, and then have virtually nobody follow up on them because the limited number of public health department personnel in those jurisdictions just couldn't handle 40,000 individuals. So that brings us to February 28th. And on this day, we get another case in Snohomish, Washington, which again is in Seattle, King County. It's relatively close to the original case. So there's a question of, all right, how are these cases linked? And then out comes the genetic data. And I'm using here a tweet by Trevor Bedford, who was in charge of the Seattle flu surveillance study, where he talks about this case WA2, or the second genome sequenced in Washington. He points out that it's on a branch in the evolutionary tree that descends directly from WA1, which was the first reported case in the US, sampled January 29th, also found in Snohomish County, Washington. Now, if we zoom in here, we can see that, in fact, yes, the WA2 sequence is directly descendant from WA1. In fact, it differs by only 3 mutations. There are other sequences from China throughout this tree, including some closely related to WA1, but here we have 2 cases in Seattle, Washington, one directly descended from the other, and sort of classical molecular epidemiology says, well, these are descendant, this is a cluster. We have a cluster of SARS-CoV-2 that's been spreading around Washington state for the last 6 weeks undetected, and containment failed. As Trevor stated, this strongly suggests there has been cryptic transmission in Washington state over the last 6 weeks. I think that was something that was genuinely believed at the time. Then what happens over the next month? Well, we get 2,580 confirmed cases in Washington state, leading to 132 COVID-19 deaths. And most of these cases are found in a single genetic cluster. And in fact, you can see that here, where the arrow up top is pointing to the largest of the Seattle clusters, which we'll refer to as the Washington State Outbreak clade. But if you look across this tree, which is just showing you the number of mutations that separate SARS-CoV-2 sequences, you can see that there are many, many other introductions into Washington state, that is, red lineages or nodes that pop up elsewhere in the tree, including a moderately sized cluster just in the middle there, but we have repeated introduction of the virus. Okay, so we move forward to January 20th, and now we go across the world. So here, we're going to Germany, because on January 20th, a woman who worked at a auto parts manufacturing plant flew from Shanghai to Bavaria, Germany, and was diagnosed with SARS-CoV-2. We know that this virus is probably directly linked to Wuhan because this woman's parents had spent the previous week in Wuhan, China, before meeting her in Shanghai, and then she traveled to Bavaria to work at this. It was not a BMW factory; they just make parts for BMW. Okay, so then by January 27th, that genome is sequenced from a man who she transmitted to, and that sequence is given the name BAV-PAT1, BAV for Bavaria. So that's why I keep mentioning that region of Germany. Okay, so over the course of this outbreak, which was far more extensive than any detected in the US at the time, there were 16 employees infected, all linked to each other, and through extensive contact tracing and rapid testing, it is believed that they contained this outbreak. And this was hailed as a public health success story. That was until February 20th, where we see the beginning of an outbreak in Lombardy, Italy, which was the heaviest hit region in Italy and possibly through most of the pandemic, all of Europe. And the genome sequences out of that epidemic show that there are very few Italian sequences, but the one Italian sequence that you see here is actually very, very close to the Germany BAVPAT1 genome. In fact, differs only by one mutation. And that led to the inference that it's possible that the German outbreak had persisted undetected and spread into Italy. And that we had seen this same cryptic transmission going on in Europe over the course of this case, only about a month. And if we zoom in here, you can see there's the German BAVPAT1 sequence. There's a single mutation who has a name that a lot of people will be familiar with. It's 614G, and it goes into Italy. We're not going to get into the importance of that mutation in this talk, but just know that the founding strain in all of Europe was the D614G mutation. All right, so then Mike calls me up and he says, you know, I've been thinking about Washington, been thinking about Germany, and I don't think the official story holds water. I don't think that WA1 led to the Washington outbreak, and I don't think that BAVPAT1 led to the Italian outbreak. And we only have 2 mutations for Washington to distinguish these lineages, and we only have 1 mutation in Europe. There's an opportunity here. Can you determine whether or not 1 or 2 mutations is enough to distinguish independent viral origins? And I got to admit, I was a little skeptical, but he was a bit convincing.
Now you're just going to have to turn this opportunity, yes.
Well, something like that. He accepted the opportunity and got me thinking about sort of the curious nature of SARS-CoV-2. So this is a phylogenetic tree showing all of the diversity of SARS-CoV-2 to date, ranging from its time of most recent common ancestor in mid to late December to sequence sampled through the end of September. This is a lot of genetic diversity. This isn't even all the genomes we've sequenced. This is only actually a small fraction of them, not even a tenth. But what is remarkable about SARS-CoV-2 is how slowly it evolves compared to other RNA viruses. All of this genetic diversity that's accumulated in the last year is an average of only 15 mutations from the root. That means over the course of about 10 months, we've only had on average about 15, 16 mutations. It means every mutation in SARS-CoV-2 is meaningful. In fact, those long branches you see at the tips, those are probably sequencing error and they're going to throw us off in this, and we need to ignore them. But importantly, if a virus is only expected to accumulate 24 mutations over the course of a year on average, maybe 2 mutations is meaningful after all. So that brings us back to Washington State. And we're going to now go revisit to ask ourselves, actually I'll zoom in on here for you, whether or not WA1, which is shown at the base of the tree here in the lower left-hand corner, there are 2 mutations that separate it from the Washington outbreak clade. There's 17858 and there's 17747, 2 mutations in the helicase protein. Now, is it possible that WA1 could have arrived in Washington State on January 15th, continued to circulate, and only experienced 2 mutations before giving rise to this outbreak clade? That's the question we had to ask ourselves. Now, I should point out here that there are actually some other sequences interspersed. So if we go back, we can see that there are also sequences from British Columbia on the way between 17858 and 17747. Those are shown in that teal color. So there are Canadian intermediary sequences. And the question is, did it start in Washington? Did it go to Canada and then come back to Washington state? Essentially, as I previewed, can we blame Canada for this? Now, if the answer was yes, I would not put up such an inflammatory statement. Also, blame is the wrong word here, but it just seemed right. Okay. Now, what is important about these mutations? Well, 17747 is a little weird. Now, I'm going to pull out a sequence from Washington here. There was one Washington sequence that actually had a C at 17747 and a T at 17747. And that could mean that, hey, maybe that Washington sequence was there and it's the intermediate sequence. However, it also has 9 other mutations. We see them across the genome at 222, 44, 56, all the way up to 29, 188 across this 30 kilobase or 30,000 nucleotide genome. We see 7 additional mutations for a strain that has a C at 17747. Those same 9 mutations, a strain that has a T. Now, is it possible that 2 independent strains in Washington acquired the same mutation? Yes. Is it possible that they each independently acquired 9 mutations? Almost certainly not. The odds against that are astronomically small. So, is it possible that the reason that the top sequence there has a C at 17747 is sequencing error? Well, we think so. And when we look at a whole bunch of the other sequences from British Columbia, Oregon, Wyoming, Minnesota, all of these sequences that share a C, 17747, also have a paired sequence that have a T at 17747. And they all share these other mutations. You can see all of those matching lines. If we just go to the top sequence there, we see 4 mutations in that top sequence from British Columbia. There's another sequence that shares those same 4 mutations, but has the derived T at 17747. So this got us thinking, these have to be sequencing errors. In fact, a lot of these, if you look at the deep sequencing analysis, they're actually 50-50 C and T. And what it turns out is that the Arctic protocol, which was used to sequence these genomes, has a primer right around this region. What we're seeing is that all of those intermediate sequences in between WA1 and the outbreak clade that have that intermediate C mutation, we believe all of them to be sequencing error. And in fact, if you look at sequences published now on GISAID, they tend to have a long string of ends in that region using the Arctic protocol because people have realized this is an issue. So you don't have to blame Canada, not this time. All right, so we can ignore all those intermediate sequences and just focus on WA1 and the Washington outbreak clade. And ask, can we get there in 2 mutations without leaving any other descendants? So how would that work? Okay, so let's just give ourselves a hypothetical example here where the colored dots represent infected people. Now, WA1, that outbreak genotype, is shown in teal, and it has an A and a C. And it doesn't leave any descendants with that genotype to survive to present day. It can transmit a little bit, but then it goes extinct, and that's shown by the ceasing of the blue lineage going forward. But it also experiences a mutation that goes from A to G, and now we turn pink. Pink may leave a handful of transmission events, but no descendants to present day. But one of those pink strains experiences another mutation, and that's from C to T. And that is the strain that we end up sampling. So we see WA1, 2 mutations that leave no descendants, and then this outbreak clade. And we just have to ask, all right, that's what we observed. How often could that have happened? Or what are the other scenarios that we might expect? Well, the other scenarios we might expect are that, in part A, not only does that happen and the intermediate strain goes extinct, but we also have another mutation where now we have another strain that's 1 mutation different from WA1. Or WA1 genotype could have survived until we recognize the outbreak in Seattle, Washington, and we would see these two strains, or we could have an intermediate strain with one mutation, that pink lineage shown in part C, that could have survived to present day. And we don't see any of those other scenarios in the data, but what we want to know is how probable could they have been? Now, to address that, we turn to a program that we developed here at UC San Diego called Favites, which basically does forward epidemic simulation. And this was pioneered by my colleagues Nima Moshiri and Siavash Mirab, and also with contributions from my former postdoc, Manon Ragane Cronin. Now, how does this software work? It basically just takes a whole lot of cool things we can do in epidemiology and molecular epidemiology and puts it all under one roof. So it generates a scale-free contact network. It builds an SIR model of susceptible, infected, and recovered people. And it propagates that infection over the contact network to give us a transmission network where people are susceptible or infected. We can then take that transmission network and the pattern of transmission, turn it into a tree that just shows when people got infected and when they were sampled. We can subsample that tree so our software can handle the massive size. We can build a mutation tree out of that, saying how many mutations would you expect along this given period of time. We can simulate sequences, A's, T's, G's, and C's at a substitution rate, and then we can build that tree and say, what phylogeny would we get had that simulated epidemic actually occurred? Now, it's very important here, as The Atlantic pointed out yesterday in this wonderful article, not to look over a key variable in this pandemic, and it's not R, it's K. And what is K? K is the dispersion factor. So just having an R naught of 3 in a simulation won't be sufficient. You need to have a long tail of people who may give rise to super spreading events. We see that here, where although the average person in our network has 16 contacts, some people have up to 400 or even 800 contacts in our social network. So we are clearly over-dispersed there. In our transmission network, we see that the person with the maximum number of transmission events across our 2,000 simulations can infect up to somewhere between 40 and 120 people on average. So we're clearly having super spreading events. And that leads to a substantial number of people with more than 14 transmissions attributed to them in the simulated network. So our network seems pretty realistic in terms of how we know that SARS-CoV-2 spreads. Okay, so we simulated 1,000 epidemics starting on January 15th. We let them go for 61 days with a median epidemic doubling time of 4.7 days. We, on average, had about 4,000 people infected at the end of our simulations. We had our evolutionary rate of 0.8 times 10 to the minus 3. And on average, we managed to simulate sequences that are about 3 mutations away from WA1, which matches the real data. So now the question is, what did the trees from our epidemic simulations look like? Well, how many times in our simulations did we see at least one sequence that was identical to WA1 in the simulation? Those would be red sequences. So even though we got into our outbreak clade, there was one sequence that for whatever reason just didn't mutate, but we sampled them at the end of the 61-day period. Well, in 70.1% of simulations, we observed that. Well, we didn't observe it in real life. We only observed it 70% of the time in simulations. Okay, maybe we shouldn't really expect to see those identical sequences. What about sequences that are one mutation away from WA1? Well, we didn't see any of those in real life. We saw them in 95.5% of simulations, which suggests that maybe this 2 mutation hypothesis isn't accurate. All right, what about a lineage that branches off from the base of the tree? So you have a mutation away from WA1, you go off to found a second founder lineage. It's not as big as the WA outbreak clade, but it still exists and can be detected. We see that in 97.7% of our simulations. And then if we look to say, all right, what about a clade that diverges at 0 or 1 mutation before the outbreak clade? We find in 100% of our simulated epidemics, we see a sibling lineage to the WA1 outbreak clade that branches off at either 0 or 1 mutation. This tells us that it's very, very unlikely that WA1 could persist in the population, experience 2 mutations, and leave no other descendants, and end up infecting thousands of people over 61 days. So again, we saw no instances of the true phylogeny where we ended up with 2 mutations and no other descendant lineages. While the paper was in review, somebody published WA1 which was sampled on March 29th, 2020, outside of our 60-day period. And it diverged basally from WA1 to the outbreak clade. So that kind of throws everything up in the air. Well, we did see one. Now we have to go back and revisit our simulations and say, how often do we see 2 lineages branch off before the outbreak clade is founded? Because we know we see 1, so now we have to change our null hypothesis. And what we found is that in 99% of the simulations, we see at least 2 lineages branch off with either 0 or 1 mutations before the outbreak clade. So WA1 notwithstanding, we're still quite confident in our results. And but that did raise the question that we do need maybe some more sophisticated analysis to understand, where did WA6566 come from if we don't think it was descended from WA1? For that, we get into phylogeography. Now, some of you may have heard of this program called BEAST. It is an extraordinarily powerful phylogenetic tool which can infer the age and migration patterns of viruses, and it can incorporate all sorts of information such as travel history. So you can give it information on flight patterns and have that inform your phylogenetic inference through a phylogenetic generalized linear model regression. But we have another problem here, is that at the time, there were only about 500 full genome sequences from China. So not only, so we have a lot of missing sequence data. And what do you do when you have missing data? Well, you resurrect it with a ghost. And that's what we did. We evolved these so-called ghost lineages, which essentially we have no sequence information for them, but we do know that they likely existed because there were hundreds of thousands of cases in China, and we also know at the time, and we also know that we also know the travel patterns between China and Washington. And we use this method developed by Philippe Lamy and Marc Suchard, which accommodates all of this information. It's currently available in preprint, and you're essentially able to infer trees with lineages that don't exist. And the lineages that don't exist, these so-called ghost lineages, are shown here with dashed lines. So you can see the teal Chinese other sequences that have no information on them, except for the fact that we know travel existed between China and Washington State. And what we can infer there is that WA1, which is down at the bottom, likely came from China. And then the virus persisted in China. If you follow the tree going back, you can see you enter into all of this red, which says the virus was in Hubei, China at the time. And then maybe it spread to a different part of China. And then somewhere around February 1st, it made the jump from China to Washington State. And it may have done this repeatedly, going from with multiple introductions into the US, one into New York and various ones into Washington, suggesting that we've repeated introduction of this virus into the US. And in fact, we see this same pattern of apologies for the resolution here, where if we ignore the ghost lineages, but we only include the flight data, we can see that it's still WA the Washington outbreak clade shown in blue is a separate introduction from China into the United States. So phylogeography and phylogeodynamic analysis agrees with our simulated networks. Oh, sorry, we've already covered that. Okay, so we now think that there were two introductions into Washington State, and just by coincidence, they happen to share some of the same mutations. But given the sheer number of introductions into Washington State, it's not unreasonable to think that we had repeated introductions, and just like I said, by coincidence, the first sequence happened to be genetically similar to the main outbreak there. So as we return to Germany, we can ask the same question. So we have BAVPAT1, that sequence in Germany, and then we have this Italian outbreak clade, and they differ by one mutation. And the question is this: you allow it to evolve for a month. How often do you expect there to be one mutation with no other descendant lineages? And the answer is, in our simulations, out of 1,000 simulations, we observe this 0.6% of the time. So it's extraordinarily unlikely that this pattern would have taken hold. And as we look across our other options, we see that 84.4% of the time we would have sampled the sequence identical to BAVPAT1 after a month. 84.3% of the time we would have sequenced a genome one mutation from BAVPAT1 after a month, and 99.4% of the time you would expect a second lineage, what we call a polytomy lineage, that comes off the base of this tree that is oriented sister to the outbreak clade and BAVPAT1. And we observe this in 99.4% of our simulations. So here, from this we can conclude that the German outbreak and containment was likely sufficient and did not lead to future spread in Europe, and that it was likely a second introduction into Italy that gave rise to this, to the Lombardy outbreak. We can do the same thing here with the phylogeodynamic and phylogeographic analysis. So BAVPAT1 and the entire German clade, outbreak clade, are shown in the bottom there in some sort of soup green color. I didn't pick that color. And we can see that that outbreak most likely originated in China, which of course we know because we know the woman flew from Shanghai, and we know that her parents had recently visited Wuhan, and we know that she had contact with the gentleman whose sequence was used for BAVPAT1. And according to our analysis, we would have expected a lot of ghost lineages in China that we didn't sample, coming from Hubei, China, and some additional sequences from China that we did sample that would be intermediate between the German sequences and the Italian outbreak shown in green. Now, importantly here, only a handful of those Italian green sequences are actually from Italy. The rest are inferred based on travel patterns, and those are shown with the dashed lines. However, we do have a lot of other sequences from the rest of Europe, which are shown in solid colors, such as blue or orange or purple. Sorry. And we can infer, based on this analysis, that the transition between Hubei, China, and Italy likely occurred sometime in late January, with a mean estimate around January 29th. Then it persists in Europe for about a month. And from there, then it transitions into that very, very large blue clade that you see at the very top of the tree. That represents the United States. And it predominantly represents New York City and New York State. Here we see also the same lineage that was introduced into Italy from China. We then infer stayed in Italy, and then from Italy it came into the United States. And we can infer this even with the lack of Italian sequences along that lineage, because we know the case counts and travel history in these regions. So that gives us this general pattern of the emergence of SARS-CoV-2 in Europe and North America. Around January 15th, well, on January 15th, we know that the virus is introduced into Washington State. However, that lineage dies out. Then, sometime around the beginning of February, we see a second introduction into Washington State, where the virus then does continue to transmit cryptically for several weeks, for a few weeks, before it's detected. However, it was almost certainly a separate introduction into the U.S. We also see that the virus is introduced from Shanghai to Munich on January 29th, where then it goes extinct. Then we see a second separate introduction from likely Hubei, China to Italy around January 28th, where it starts to transmit. And then sometime around February 12th, it is then introduced from Italy to New York City in time to give rise to the New York City outbreak. I should also just go and point out that our earlier introduction of China to Washington around February 1st does give time for that same lineage of virus to seed the Princess cruise ship outbreak, which has sequences that are identical and embedded within the Washington outbreak clade. All right, so what conclusions can we draw from this? First, from a analytic perspective, one mutation matters a lot in SARS-CoV-2. Sequences, and if they're high quality, properly sequenced genomes that differ by one mutation, that can be phylogenetically informative and allow us to distinguish between competing hypotheses for the spread of this virus around the world, even in the absence of sampled viruses. Also important, early containment efforts were successful. When the gentleman who carried the WA1 strain arrived in Washington State, he listened to clear, concise, and helpful public health guidance. He got tested. He went in, even though no one else in the country had been infected. And through diligent contact tracing and testing, they were able to ensure that he didn't transmit to anyone else. The same thing happened in Germany. There, they did have a small outbreak, but they managed to contain it. And shows that, yes, we can contain these outbreaks. And we did early on. However, travel restrictions were ineffective. Now, this means that only blocking foreign nationals, incredibly naive to think that people from the US citizens, US residents, and their families wouldn't bring this virus back. Incredibly short-sighted. And to bring them back without the infrastructure to track each one of them and to follow up with each one of them was incredibly irresponsible. Now, I've spoken with people in public health departments whose job it was to track these people, and they were completely overwhelmed. They don't have the staff to deal with 40,000 people coming back into the United States in a short period of time. It was an impossible ask, and we paid the price for that. Also, it's very important to point out here that the virus wasn't here in mid-January. I mean, there may have been separate introductions elsewhere, but it was not circulating. We did not have undetected transmission clusters of this virus in January, which means we had more time that we wasted. Now, given that we're sitting here in October, the idea of wasted time in January and February kind of seems quaint, but it's important to know that we did. And had we been able to ramp up testing, we could have delayed introduction even further, which maybe could have helped, especially places like New York City, get their epidemic under control. And so with that, I'd just like to pause or stop and take any questions that people may have. Thank you.
Joel, that was excellent. I hope people will unmute themselves and ask speak. Please do.
Well, Joel, I'll just ask Susan, at what capacity do you think public healths are nationally now to respond? I mean, I know we're doing contact tracing now, but we're seeing pretty good numbers now in terms of contact tracing in San Diego, but sort of at a national level, i.e. the Midwest. Do you have any sense of what proportion of people that are infected are actually getting adequate contact tracing?
No, I don't know any have any numbers on that. I do think as we've learned more about this virus, and actually that article in the Atlantic, I think, said something that, well, I guess I had always assumed was happening, and it sort of clarified the public health departments around the country aren't really doing it, which is contact tracing to look for sources of large super spreading events in general. In that, if someone's infected, they look to see who they've had contacts with, but not necessarily trying to figure out where do they get infected and is this sort of a large source of the virus. Now, one thing that is sort of implicit in the work that we've done here, but has been made abundantly clear by other sort of studies that have been designed to do it, is the sort of stochasticity in viral transmission, how you can have repeated introductions of SARS-CoV-2 into the United States, into Washington State, into Snohomish County, but they don't all take hold. And in fact, most people who are infected with the virus probably don't transmit, which means we need to be focusing a lot more on these sort of large clusters of transmission. And if we go back and we think about like the early cases in California that were diagnosed retrospectively, even though they weren't linked to travel, they were almost certainly dead ends, because this virus tends to die out very quickly unless it gets into a sort of multi-person transmission event. And so I think that's sort of relevant here for contact tracing, is we need to think about sort of large sources of transmission, and then if people were at those events, contacting all of them.
Hi, Joel, this is Connie. So I have kind of two questions. The first has to do with a lot of speculation based on the relatively slow occurrence of mutations that you mentioned early on in your talk, and whether these mutations are associated with different sort of, I guess the way to, I don't have the right words to ask, but are they different pathogenically in terms of the clinical syndromes that they produce? There's been some speculation that people who acquired more likely virus from Wuhan lineage on the West Coast have some different manifestations of disease than people who acquired lineages that passed their way through Europe to the East Coast. And do you have a sense from your discussions with all of your colleagues, have these mutations that you're seeing as they've spread and further mutated been associated with different degrees of pathogenesis or clinical manifestations?
Yeah, so that's a big question. We had a one day, those of you familiar with the HIV dynamics meeting, we had a COVID dynamics meeting about a month ago, and there was a very lively discussion about this point. And it primarily, although there have been a lot of mutations that were discussed early on, putting the sort of the 858, 8584 mutation. The D614G mutation has sort of become the focus. And the reason is because that original Washington outbreak was actually the sort of Wuhan wild type of D. And then now across Seattle and almost all of Europe and the United States and in much of the world, all you see is that G variant. So it swept to fixation, or near fixation. Only I think the persisting clade in Singapore is still, they have there, but there's very, very little sort of D614 left in the world. And this led to speculation that it was adaptive and more transmissible, potentially more virulent. If the entire world were an intermixing population where everybody just randomly bumped into each other, and D614G swept to fixation, that would be sort of unambiguous evidence that it was highly adaptive for the virus. That doesn't necessarily make it, because what the virus wants is to transmit, not to, hurt and kill people. So selection for transmission may lower or may reduce morbidity and mortality. It really depends on sort of if transmission is coupled with virulence or not. Sorry, just to take a step back, like in malaria, for example, if you're really, really sick, you can't swat off mosquitoes from biting you. And a mosquito can bite you, needs to bite you when you're infected to pick up the parasite and continue to transmit. And the same with something like cholera, where the sicker you are, the more bacteria you expel, the more you are likely to get into another water source. So there's some viruses and bacteria where it's very, or in this case, prokaryotes, where it's very advantageous to be more infected because that makes you more virulent.
Mm-hmm.
We don't know if that's true for SARS-CoV-2. And back to your original question. So because 614G is the founding mutation in Europe, that means that we sort of had these initial outbreaks, we responded to them, and then comes in this new variant where public health is overwhelmed and may just have more success in transmission. And of course, you have a lot of stochasticity. The field in general, I think, is moving towards perspective that there might be a slight adaptive advantage, but it doesn't seem to be as sort of big as first thought. And part of that is because of this founder effect, that this is the strain that got into Europe and then got into New York City. And that alone propelled it, because the earlier strains were just sort of rare introductions. But that being said, it does seem to have outcompeted all over the world, so there may be something to the story. Whether or not it's actually causing more disease, I don't think anyone's worked that out yet to sort of convincingly in people.
Yeah, I think there's a lot of speculation recently too that there may be more, it may be more transmissible, but causing less disease, which I guess you could say, kind of going back to your point, decoupling the virulence from the transmissibility concept. If it transmits more, but people are less likely to be symptomatic, then they'll transmit more.
Yeah, which of course, is part of what makes SARS-CoV-2 such a nefarious foe, is that, we were prepared to fight, something that, killed 30% of people, and you knew everyone who was infected, and that was SARS, and that's MERS. Something that kills 1% of people and is very often undetected is, well, that's the pandemic we're living in. That's not to say it's the only way we could have ended up here, but that's how we got here.
Well, people have used that number of 1 kills 1% of people to say it's no big deal, but 1% of 300 million United States citizens is a big deal. So
exactly, and it being able to sort of transmit and sustain in communities for long periods of time is it's sort of one of its most sort of diabolical weapons.
Well, this is a fascinating talk. So congratulations on all the work you and your colleagues have done.
Thank you. I see a comment from Sarah in the chat. Okay, any insights into the 2 cases identified post-mortem February 16th and 17th in Santa Clara? As far as I'm aware, these people were older and not traveled, indicative of community spread. Yeah, so that's sort of this pattern that we see. I mean, there are these there are these, and that was almost certainly, yeah. So I think we don't have genetic data from them, so I can only speculate. But my best guess is that there was limited community spread in California in early February. There were introductions, there was community transmission, but then it just went extinct because most people don't transmit the virus to anyone. A handful of people transmit to a large number of people, and that would explain why we could have sort of repeated introductions of this virus that just never took hold. And it's only when you get into sort of large or even moderate super spreading events that you can guarantee that one of your descendants will continue to propagate in a community. We're continuing sort of our work on this to understand viral introduction, and maybe in 3 or 6 months I'll give another seminar on it. But yeah, I believe, like, there's also the case in late December in France that could very well be real, and it just died out. We don't see any genetic evidence that these clusters led anywhere, because the ancestor of all California sequences postdates this event. So it wasn't. There may have been the virus here, but the virus we have today didn't descend from it, so it must have gone extinct. Sorry, someone was going to ask a question.
Yes.
Cool.
Oh,
Yeah.
go ahead, Francesca.
Excellent, excellent. And so I have a question more regarding what the strategy should be given what you just presented, meaning that strategy is still not well defined in the United States, as you pointed out. And even though local public health community systems are a little bit better in diagnostics and contact tracing, it's clearly not uniform, and it is yeah, it's not being done, I believe, enough to kill the transmissions and kill the chain of transmission. And so I see two things, which is one is widespread testing, which we are lucky to be doing here in San Diego, thanks to the Return to Learn program. As you know, we did not go to purple, right? In the county, we remained in red. And that was because we were testing enough that permitted us, even though we had more infections in the county, thanks to the SDSU outbreak, it permitted us to stay going. And so the issue is really mitigating enough to continue opening safely the different businesses so that we don't all crash and burn. Any more suggestions that you have apart from aggressive testing that includes asymptomatic folks and aggressive identification, case investigation, and contact tracing?
Yeah, I think sort of I mean, I can speak more broadly, but I think what sort of this work speaks to is this the stochasticity of transmission and of establishment of clusters. And I mean, from what I've been told, the sort of SDSU outbreak was really sort of one large event. It wasn't like a whole bunch of students brought a whole bunch of different viruses. It was one giant cluster. And we need to, I mean, if there's not one strategy that's worked in the world, there's plenty of strategies that have failed. But I think we need to be cognizant of the importance of super spreading in this virus. I mean, it was something that was sort of first described for SARS and even for sort of HIV, the work that Susan's done, that Sanjay and Antoine and I have done, really just sort of demonstrate that there are a few people that tend to transmit a lot, and you end up with sort of these large cluster of transmission. Well, SARS-CoV-2 is just like that as well. And we need to sort of eliminate opportunities for super spreading. Is that going to get the virus down to zero in the U.S. in absence? No. I mean, won't share my pessimism and despondence with the group, but indoors, poorly ventilated areas, these they just shouldn't be in our vernacular. Close contact for long periods of time. We need to. I hate to say that. I'm really worried about Thanksgiving.
Well,
I think people are going to travel, and I think it's going to be a disaster.
but I think that your point is two things that I hear, right? It's eliminate the opportunities, and so that is clear, but also isolate and quarantine, right? Which we are not doing. We are not, there's this whole confusion of isolation. We need to isolate, we need to identify early and isolate those, but then also quarantine properly.
Yeah, I mean, UCSD has the sort of the convalescent dorms for quarantine and for isolation. We had hotels in San Diego. Nobody used them. We're sitting empty. I mean.
So the reason I'm saying this is because what I see, what I see in the small cosm of UCSD is a resistance to quarantine, to apply quarantine still, and I think the public health systems are not able to. They're able to isolate somewhat the infected people, but they're not able to enforce quarantine. And that's where, further spread can occur. And I think that really pointing that out, taking out the meetings, taking out the super spreader possibilities is definitely important, but then you have to kill the transmission.
Well,
Absolutely.
it's just about 9. I don't know if you want to have the last word before we go. I mean, we could go on about this for a while. It was an amazing talk. You were highly praised in the chat. I hope you can see it before you go. It was really informative and very well delivered. Next week, we have a totally different, we're turning and we're going in the cystic fibrosis phage therapy route. We're having a speaker courtesy of Chip Schooley, Stephanie Strathy, and the iPhage program, or iPath program, sorry. So that should be really exciting. Again, we're keeping things interesting here. But Joel, thanks so much, and everyone have a great day.
Thank you. Thank you all for attending.